Everybody's good with that? Lovely. Alrighty. So I'd just like to welcome everybody for coming today. There we go. We'll just admit. Our guest speaker today is Alyssa Beaven. I hope I said that properly. Wonderful. I'm just going to read a little biography that she has provided me, and then I'll pass it over to her. So Alyssa's been a physiotherapist working for 12 years. She spent much of that time so far working with COPD patients and other patients with respiratory conditions. She really enjoys helping people manage their breathing better and seeing the difference that just a few breathing techniques can really make for people that are struggling with breathing. When she started physiotherapy school, she assumed that she would want to work in private practice with sports physiotherapy, injuries, that sort of thing. But after working a few placements in acute care, what she really found was that her passion was in that respiratory pathophysiology, physiotherapy aspect and helping these people. So our audience today. She has also worked with respiratory clients out in the community, in their homes, and she works with our pulmonary rehab program here in Kamloops. Currently, she's working in the hospital as a home health therapist. She's helping with complex discharge planning and getting people set up at home so they can stay home and be safe. When she's not at work, of course, she stays busy with her 2 kids, her dog and her cat. And like most BC people, she enjoys camping and spending time outside in the summertime instead of being inside doing some work, which she's doing today. So she also has taken up some new COVID hobbies, such as baking, fancy sugar cookies, hello, and making her own sugar or vanilla extracts. So without further ado, I'd like to say thank you and welcome to Alyssa, and I'll pass it over to you.
Thank you, Lindsay. Can everyone hear me okay? All right, good. So I'm just going to share my screen here so that I can get my slides up. Let's see. There we go. Can everyone see my slides? We're good. All right. So as everyone here should know, the topic today is bronchial hygiene, which is just a fancy way of saying getting the goop out of your lungs. I'm assuming most people here have experienced periods of their life where they have secretions in their lungs and you've had to try to work to get them out. So we are going to, hang on just one second here, there we go. So we're going to have a little chat about what that all means, what are some things we can look at and how we can help you. So brief outline, bronchial hygiene. So we're going to discuss techniques for self-management so you guys can better manage those secretions. A little bit of a glossary, a couple terms that are going to come up quite often. So secretions is just the mucus in your lungs or in your airways, depending on where they are. And then atelectasis, I'm going to say a few times, is a collapse of part of the lung, and it's often because of a mucus plug. So if we can clear the mucus, we can reinflate the lungs. So these are some words that are going to come up. And as Lindsay said, if you have questions, pop them in the chat box and we'll address them at the end. So what is bronchial hygiene? Bronchial hygiene involves the use of a non-invasive airway clearance techniques that are designed to help mobilize and remove secretions and improve gas exchange. Or in other words, how to get the gunk out of your lungs so you can breathe better. When the lungs are full of mucus or secretions, the air from the lungs can't enter your bloodstream very well, so we're not getting as good oxygen exchange. So we want nice, clean airways so we can get as much oxygen as possible. So what are some indications for bronchial hygiene? So in some cases, you have excessive sputum production. So with COPD or bronchiectasis or cystic fibrosis, where you create a lot of excess mucus. Some people may have an ineffective cough. So either weakness, pain, or neurologic. So something like fractured ribs would make it difficult to cough. Or someone with a condition like ALS may have weak muscles around their ribs, which would make, and a weak diaphragm, which would make it harder to cough. We do use bronchial hygiene prophylactically. So people with known pulmonary disease, sometimes we do regular hygiene just to maintain clear airways. And then in therapeutic applications, so atelectasis due to secretions. So sometimes post-surgery, people who aren't moving or breathing well, they'll sometimes get excess secretions and some collapse in the lungs. So we do therapy for that. And then COPD, I think, which is most of the people here, or musculoskeletal deformity that makes coughing ineffective. So if somebody is quite kyphotic and curled in or bent over, it makes it harder to breathe and cough. So some goals for why we would want to do bronchial hygiene. So it kind of relates to the previous slide. So we want to prevent the accumulation of secretions. We don't want fluid in the lungs. It's not where it belongs. We want it out. We want to improve mobilization and drainage of those secretions. So I'm going to show you different ways to get that stuff out. We're going to promote relaxation and to improve breathing, improved respiratory function, and improved cardio-pulmonary exercise tolerance. Because when you have fluid in the lungs and you're not getting as much oxygen, your exercise tolerance is going to be affected. So that is what we're going to work on. And if at any point, I'm just going to make a mention, I do tend to talk quickly. I try to slow down. If I am talking too fast, if you make mention in the chat, then maybe Lindsay can let me know. All right. So how do our lungs normally stay clean? So we have in our airway system, we have our nose, we have our mucus, and we have our cilia. So the cilia are those little hairs that line our airways. And we'll go over their function in a few minutes. So the nose. So nose breathing versus mouth breathing. What's better? Usually when everyone's telling you to take deep breaths, they're almost always saying breathe in through your nose. And there's many reasons why we say that. So when we breathe in through our nose, it warms the air as it goes through our sinuses, humidifies the air, and filters the air before it reaches our lungs. The other thing that breathing in through our nose does is it triggers more use of the diaphragm for breathing as opposed to our accessory muscles up at the top. So we take deeper breaths when we breathe in through our nose. Mucus and secretions. So mucus is something that our lungs and our nose and our airways produce all the time. It has a purpose, but when there's too much is when we have the problem. So the mucus that we produce daily helps keep the respiratory tract clean. It traps those harmful particles and chemicals and keeps them from entering our lungs. And then throughout the day, it's being moved to the back of the throat and you're swallowing these secretions all the time. And you don't even notice it most of the time when they're at normal levels. So the cilia, as I mentioned, those little hair-like projections that move that mucus blanket to the back of the throat. So they're in the airways, they're constantly sweeping the mucus up and out. So it's going to bring it up out of the lungs, out of the airways, and then you're going to swallow it down into the stomach, which neutralizes and eliminates harmful particles. And so the sinus and nasal cleaning action provides a good defensive mechanism against infection. But if the mucus becomes stagnant or begins to accumulate, then bacterial overgrowth can develop. And when mucus begins to slow down or stop, it provides a breeding ground for viruses and bacteria. And so this is a contributing factor to sinusitis, nasal symptoms, and lung infections. We also do know too that cigarette smoke can inhibit the normal movement of cilia. So people who are smoking, their cilia doesn't sweep that mucus out nicely the way it's supposed to. So we get increased secretion retention if that cilia isn't working properly. So with that being said, in normal circumstances, our mucus, cilia, it's all working together to keep everything clean. But if we're having an issue, if we are getting increased secretions or we have chronic illnesses or things that do create more sputum, how do we keep the lungs clean and healthy above and beyond what our body is already doing? So we're going to go over these different things. So the number one thing we recommend is exercise. And I'm going to go over why that is. We're also going to review deep breathing and coughing, positioning, and some little devices that I've got here to demonstrate to help move those secretions. So how does exercise keep your lungs clean? So immobility, we know, is a major factor contributing to retention of secretions. So early mobilization and frequent position changes are preventative for atelectasis. So remember, that was that collapse of the lung, often from mucus plugs. So if you've got a mucus plug in the lung, the airways behind that plug won't be inflating and they'll collapse up. If we clear that plug, those airways can open back up again. Exercise will also improve overall aeration and ventilation perfusion matching, which basically means that as you're breathing, the gas is exchanging properly through the lungs. And exercise can improve a patient's general fitness, self-esteem, and quality of life. So the reason we really like exercise as a lung clearing technique is because it has so many other benefits to the body and not just the lungs. So how does exercise keep the lungs clear? When we exercise, which doesn't have to be running or biking or anything super high intensity, it could be walking, light jogging, or even doing the stairs, we tend to take deeper breaths. When we take deeper breaths, we're forcing air to the very bases of our lungs, which can help it get behind any secretions that are down there. And then when we breathe out, the air helps lift the secretions up and out of the lower airways. So as we're more active and moving around and in an upright position, our breathing helps to mobilize those secretions. And like I said, the exercise has also so many other benefits to our body that it's why it's our first choice for secretion management. But, and the question a lot of people often then have is, what if we can't exercise? What if you're in a situation where you are having to be in bed? What if you're quite sick and you can't get up and walk and move around? That's where we go into some of these other techniques that we have to help get those secretions moving when we know we can't move people or move them too much. All right, so breathing exercises and techniques will help with mobilizing and clearing secretions, and also things like just changing your body position. So we know that laying in bed, so being flat and horizontal, our lungs and diaphragm doesn't work as well. Being upright, so even just being able to sit in a chair will help with your breathing and can help with secretion management, as opposed to laying in bed. So if all you can do is get up and sit up, that's still going to be beneficial. But then we can add some of these other techniques into getting up out of bed, sitting up, and then we can try some of these other breathing and secretion clearance techniques. So breathing exercises. So I believe the last presentation that was done was on breathing exercises. So we're just going to touch on this as a bit of a review for anyone who was there and anyone who wasn't. So it gives you a little bit of an intro to these breathing exercises. So deep breathing and coughing. So taking deep breaths in through the nose will trigger the diaphragm to activate. Taking a slight breath hold at the top of the breath allows the air to push deeper into the lungs, and a slow controlled breath out through pursed lips, breathing out twice as long as you breathe in, helps to bring that air up and in behind those secretions and get those secretions up to the point where you could cough them out. Because any coughing that we do is only clearing what's sitting right up at the top of our airways. So when we have secretions lower down, we can't just cough them out. So we have to work up a way to bring them to the point where a cough can clear it. So deep breathing and coughing, we encourage people to do sitting upright if they can. And again, using that pursed lip breathing. So I'm sure most people here probably do know pursed lip breathing. So that's in through the nose. And you're breathing out as if you're blowing on your hot coffee or a hot spoonful of soup or something. That nice breath out through those pursed lips. So I encourage people usually to do 10 deep breaths and follow up with a couple of huff coughs, which I will show you next, and then a good strong cough to clear out those secretions. So the huff cough, so you're sitting in a comfortable position, head is slightly forward, feet firmly on the ground just to make sure that your body is stable. Inhale through the nose and then exhale in short, non-forceful bursts while keeping your mouth open. Similar to as if you were trying to fog up your glasses to clean them, or if you're trying to make mist on a window or a mirror. And you do that a couple of times. So what that's doing is it does help mobilize those secretions from lower down in the lungs up to a higher point where you can cough them out. You want to repeat this a couple of times and try to avoid forceful expirations. We don't want to have it closing off the airways when you're doing this. Just a quick question, Lindsay. Can people see me as well as the slides? Or you guys just see the slides? You can see me as well. Perfect. Because I'm sitting here like demonstrating stuff and I'm not sure if anyone's actually seeing me. All righty. So I can demonstrate that huff cough. So sitting nice and tall, breathing in through the nose, and it's a breath in. Breath like that. So it's that, doesn't even have to be that, that much. So it can be. Okay, so it's not coughing. It is just that kind of breath out. And if you try that, you will see it does kind of move things, and usually you'll have to cough afterwards. So that's our huff cough. And then the controlled cough. So this is the other piece, is if you are coughing to try to clear secretions, we want to make sure that every cough is as effective as possible. Because if we're trying to cough and we're basically going, we're not getting much and we're just burning energy. So we want to try to make those coughs as effective as we can. So that's why we do the deep breathing, we do the huff cough, and then we follow it with a good, strong, controlled cough. So sitting in a nice, comfortable position, you can breathe in through the nose, hug your stomach a little bit if you need to. And if you want to add some strength to your cough, as you cough, you can kind of curl in a little bit just to put a little bit of extra pressure on the diaphragm, and it can give you that bit of a stronger cough. So these are the basic components for clearing secretions. So if we're using any of our other techniques, like our PEP devices or our percussions, which we're going to go over, we'd still always be using the huff cough and the controlled coughing to clear anything we do mobilize. So one thing we can do if people are very much or have a difficult time getting up out of bed, we can use body positioning to clear secretions as well. So we can position the body to optimize oxygen transport, to improve airflow to certain areas of the lungs. We can increase lung volumes. We can reduce the work of breathing, reduce the work on the heart, and increase the mucociliary clearance, which is basically that cilia that's waving in there, and try to help it with gravity. So which is postural drainage. So I'm not sure if anyone's ever had this technique done or has been doing it. It is effective. So postural drainage is where you try to get secretions to a point where you can cough them up and out of the chest with the assistance of gravity. So when we're upright, gravity is going to usually bring the secretions lower down into the lungs. So we want to try to get the secretions from the bottom of the lungs up to where we can cough them out. So I've got some pictures here, which are some examples. So if you see this fellow laying here on his back, and you can try to imagine which part of his lungs is highest up and which part is lowest down, to think of which area of the lung is being targeted. So laying on your back with your knees over a pillow is targeting kind of, well, you can't really see me all together, the front lower part of your lungs that are going to be higher. So that is this area right here. So if you know that you have secretions or atelectasis or consolidation in the front anterior lower part of the lungs, this position can help. This position here, so he's laying on his right side. So he is looking to drain the left lower lobes of his lungs to bring those secretions down with gravity to the point of coughing them out. And then we've got this super comfortable looking position over here, which is draining out the posterior, so the back lower part of the lungs. So if you've been assessed and you know which area of your lungs has the increased secretions, you can look into, or you can have them tell you positions you can lay in where you can use gravity to help. In these positions, we would then be doing our deep breathing. You can do the huff coughing, and you can do coughing in these positions. We can also do our percussions and vibrations in these positions as well, which is the next thing I'm going to talk about. So we often will use as many tools as we can to make it as effective as possible to get these secretions out. So percussions. So I'm not sure if anyone's ever had this done. I find it can be quite effective, especially if you've got these persistent stuck secretions. So we create waves in the chest to help loosen the mucus. So by using our hands. So percussion consists of a rhythmic clapping on the chest with a loose wrist and a cupped hand. So we have our hand kind of cupped. We're not slapping people with flat hands. We're using a cupped hand. So it's kind of hard to demonstrate from a little tiny Zoom camera, but if I were to demonstrate on myself, so if I just did a flat hand, it kind of sounds like slapping, whereas with the cupped hand, it sounds a little bit like a plopping noise, and it doesn't hurt. So if you're slapping people, or if people are slapping you and it hurts, it shouldn't. But with a cupped hand, you're creating a little air pocket inside the hand. And when that air pocket hits the chest wall, it helps create like a vibration that helps loosen and shake those secretions. And so we can combine those postural drainage techniques with some percussions to help loosen those secretions. And that's something I've done quite a bit for people, even through my home health position, helping people at home getting some of these secretions out. The other thing we can do is, if we can't use the percussions, there's also vibrations too. So I can do vibrations with, or the physios can do vibrations with their hands. So where you've got your hands on the chest, and as people breathe out, and kind of shake and add a little bit of pressure as we shake in, which can help also get some of these secretions moving. We also can use some of these mechanical vibrations. So I used to sometimes use these back massagers that you can spot and hold them in one spot for 10-15 seconds, move to another spot for 10-15 seconds, and target certain airways and really loosen up those secretions. And as always, we combine these vibrations with those deep breathing, with the huff coughs, with the controlled coughing to help get everything moving. Not sure if everyone knows this little thing here. There's a little vest. They do make these vibration vests. You see them more for people with cystic fibrosis who need constant secretion clearance techniques. But basically it's shaking the whole chest and helps loosen those secretions. Personally, I've even had, I remember I was riding in my friend's car and they had the bass really loud, and I had a bit of a cold, and I'm sitting in the back seat constantly coughing because the seat was rattling so much. It was shaking all the secretions loose. So any kind of vibration can help with loosening up things and then making it easier to cough out. One little device we have, sorry, one second. I will also talk about hydration later and why it's very important. So one device we used to use a lot of, I don't really see them around very much anymore. I don't even know if we can get them through our departments anymore, but it's called PEP therapy, which is positive expiratory pressure. So with COPD and some other conditions as well, when we breathe out quickly, our airways, rather than staying open, they collapse. And when they collapse, they trap air in behind. So that is the idea behind pursed-lip breathing. So if you reduce the exit for the air, it creates a little bit of back pressure into the lungs, which helps try to splint those airways open. When the airways are splinted open, air and mucus can move through more clearly. If pursed lip breathing is not enough, we have the PEP devices. So this just has a little mouthpiece. This is actually a piece from a ventilator that people have repurposed for using for airway clearance. So you got the mouthpiece and it's got a little valve in here. These ones aren't adjustable. These are 7.5 centimeters of water pressure. So the technique with these ones would be taking a breath in, similar to when we're doing our huff coughing, and you just breathe out through it. And you feel a little bit of resistance, and that's the idea, is it opens the airways and allows things to clear through. So this is what we used to use many years ago, but what they now have that is a bit more popular and more effective, and I'm not sure if anyone has one of these, we can chat about them a little later too in questions, which is the OPEP, which is our oscillating positive expiratory pressure. So this is called the Aerobica, and they are available at, I think, most pharmacies now. I don't know what the price on them is. I think about 6 years ago, they were $80, but I don't know if that has changed. So this also provides resistance. It has a little dial that is adjustable from low resistance to high resistance. And when you breathe out through this, I can open it up and show you. So it comes apart. It has a little fluttery valve in there. So what that feels like when you breathe through it is it feels like vibrations inside your chest, which helps shake that mucus loose. So this is something that people find they like to use at home, and helps to loosen things up. You don't need another person to do percussions or anything like that. So it helps with air trapping, helps with mobilizing retained secretions, and prevent or improves atelectasis, and also can optimize delivery of bronchodilators in patients with some of your medications. So the technique for this, similar to this one, but this just gives you a little bit extra. So sitting up nice and straight, a slight lean forward, breathe in slow and full, give a bit of a breath hold, give the time for the air to get down to the deeper parts of your lungs. And I'll see if you can, I don't know if you'll be able to hear this, but breathing in. So I'm not sure if you could hear that, but there is a fluttering and it helps. I always cough after I demonstrate it because it does loosen things up. So you can do that a few times, perform your huff cough and then your cough. And then if you don't feel it's enough resistance, that's why it's got the little adjustment on there. So these, again, you can ask your doctor if it's appropriate. There are some conditions where we wouldn't recommend using them. So the best option is to check with your physician or your primary care provider to see if this would be an appropriate device for you. The other thing that's nice about these ones is if you have certain types of nebulizers, you can attach the nebulizer to the back of it. So if you take nebulized Ventolin or Atrovent or any other nebulized medications, you can attach your nebulizer, you can breathe in the medication and breathe out and get the chest therapy portion of it. It's a dual treatment. And so it can really help, because if we can clear out secretions from the lungs, the medication can reach the receptors on those cells in the lungs much more effectively. Because otherwise the medications stick to the mucus and then we clear the mucus and we don't get as much medication into the lung tissue where it should be. So that's that. So some other bronchial hygiene tips we have as well. I know we're focusing a lot on the lungs with COPD, but there are also our upper airways which can get congested. And so there's different ways we can manage that. Number one thing is staying hydrated. If we are hydrated, our mucus is thinner and less sticky, and it's easier to clear. If you can imagine, if you're not getting enough fluid, dry, thick, sticky mucus is much more difficult to clear from the lungs than nice, thin, watery mucus. The upper airways, if we have a lot of congestion in the upper airways, there are also the nasal rinses. So again, you can check with your primary care provider if this would be appropriate for you. But there's different methods for these as well. So the nasal rinses, so this is the low pressure system. The picture I have here with the little pot, that's the gravity. So basically gravity would flow water through the sinuses and rinse it out. This you can add a little bit of pressure. You would use, we have little packets that come with them, or you can make your own saltwater solution, but making sure always using sterilized or distilled water. We don't want to use tap water for those. So cleaning our upper airways, clears mucus from the nose, clears allergens and irritants from the nose. So in allergy season in the spring, summer, if there's wildfires, if we're getting a lot of particulates in the nose, keeping that clear can help keep our whole airway system clear. And then there's the note, do not use tap water unless it's boiled or filtered, just because we don't want to be introducing any strange bacteria or anything up into the nose and the sinuses. So cleaning that all really well after you're using it. So again, hydration loosens secretions, improves the immune system. And then also some people do find that humidifying the air with a humidifier can be helpful. I do recall from my time doing pulmonary rehab, it was like a 50-50 split as to whether humidifying made things better or a dehumidifier in the home made things better for their COPD. So some people preferred the dry air and some people prefer humid air, and it's kind of just a personal preference. The only thing, if you're going to use a humidifier, make sure you're keeping the relative humidity low enough that we're not encouraging mold growth, because then that just adds a whole other host of problems that we don't want to get into. So I can't recall what the percentages are on that, but we want to make sure that we're not over humidifying the air as well. So for hydration, increasing your fluid intake, but we also want to be mindful of how and when we're doing that. So spacing out your fluid throughout the day. We don't want to go through the whole day and then realize at 9 o'clock at night, I didn't drink enough water and down 3 glasses of water. You'll be up all night. Making sure you're having enough fluids with meals, and then limiting in the evenings, especially if you're someone who is up at night to use the washroom. Water's the best choice. Juice in limited amounts, just because it does have a lot of sugar. Milk. Some people find milk increases their secretions. I think I don't know if it truly increases, but the milk has high fat and it can kind of coat your mouth and throat, which can make it feel kind of gunky. So some people just avoid milk altogether. Herbal teas and soups can be good options for fluids, as long as they're not high caffeine or high sodium. So other beverages, caffeine and beverages containing alcohol, they can actually be a bit dehydrating. So drinking a cup of coffee is not the same as drinking a cup of water, because caffeine can tell your body to lose more, to pull water out more, or fluid out. So we want to try to make water our primary choice of fluid. And that's about it. I think that's pretty good for time. So if we have questions, we can open that up. I can make it so I can see everybody.
Now, we didn't have any questions in the chat box, so if anybody has any questions, please feel free to unmute yourselves and ask away. Pick her brain while you've got her brain to pick.
So can I ask a question?
Sure, who's speaking?
Maureen.
Maureen, go for it.
Hi, Maureen.
Hi. I enjoyed your presentation. You were talking about if we feel our phlegm is stuck in a certain part of our lungs. I mean, I've never thought of that before. I've just thought of my lung as one whole thing. You know, I don't know if it's a left or right or up or down, but I was watching, you know, you had that fellow in those 3 positions. And I thought, if I didn't know which part of my lung, would not the 3rd position be the best one to use, which is, you know, the
face down, super comfortable looking one. Yeah. Usually people only know what area of the lung is involved if they've had someone listen to their lungs and tell them.
I've never had that.
General,
I mean,
yeah. So in general, if no one's told you, you can try laying on your right, laying on your left, see which one's more effective.
Okay.
And just try different positions. So try the different positions with the deep breathing and the coughing and see which one's most effective. But yeah,
so is it always going to be sorry, is it always going to be one? Like for me, will it always be one area or does it switch?
It can be multiple areas, and some people do need to lay on the right and lay on the left and alternate and move around. And some people, it can be isolated to a very small portion of their lungs, and some people can have it scattered throughout their lungs.
Okay.
And so it's why we have lots of different options. And sometimes it's just a bit of trial and error to see what works for you.
Okay, thanks.
Alyssa, I'm going to get you to unshare the PowerPoint, and then we can make you nice and big in the center of our screen.
All righty, how do I do that? Oops. 2 years of using Zoom and I don't often present.
There we
There
go,
you are.
wonderful.
There we go.
That's perfect. Now I do have an add-on question for myself. Do you have any recommendations how long someone should stay in a certain position before switching? Because the drainage won't happen within 5 minutes.
No, and it's usually we'd probably aim for about 15-20 minutes.
Okay.
And then just see. You don't obviously want to be sitting in a position with your head down for too long if it starts to make you feel unwell. Some people might feel a little lightheaded or dizzy with their head down, or that fullness in their head. If that's the case, then we wouldn't do that, and you just do more of the other techniques for clearing and coughing and deep breathing. But if you tolerate the kind of head down and it doesn't even have to be head down. You could be laying flat on your right or left side, and you're still going to be putting that lung higher up, and it's still going to help gravity go down. You don't have to be tipped. Just thinking about where the lung portions are and just trying to get a little bit of gravity assistance can help.
I have a question.
And who's speaking?
Barry.
Barry.
I find in the morning when I get up, the mucus is sort of darkish in color, whereas during the day, the mucus is always totally clear. Does that mean that during the night, the mucus is sort of doing a cleansing action?
It's hard to know exactly. I think what ends up happening at night is we don't breathe as deeply at night. And so the mucus isn't moving as much at night. So it's kind of sitting and consolidating a bit, whereas through the day, we're clearing the mucus a lot more effectively. So it could just be kind of a little more concentrated in the mornings. Kind of similar, I can kind of say similar to say your urine first thing in the morning is usually dark and concentrated, whereas if you're drinking water throughout the day, it's lighter in color. Because as the mucus sits in there, we're going to maybe pull a bit of fluid out of it throughout the night because it's not moving. And it is common to have more secretions first thing in the morning because we're not taking deep breaths all throughout the night. We breathe a little bit more shallowly. And then when you get up, it's kind of, oh, you got to clear all that stuff that kind of got stuck throughout the night.
So it's not a common thing then?
It's not uncommon, Barry.
It's not uncommon.
Oh,
I wouldn't necessarily say it's a problem.
Yeah.
If you're starting to notice that it's like very dark in color, blood tinged, brown, or things like that, really thick and sticky, and continues throughout the day, then we would get that looked at. But if it's clear through the day and just a little bit darker in the morning, also could depend on what you're eating or drinking before bed too. So if you've had coffee or something in the evening, you might have a little bit of color still in your system as well too.
And Barry, I'll tag on to that. If you are noticing, like Alyssa said, where it's getting thicker or stickier or it's harder to clear, then keep an eye on it, how you're feeling as well. If you're starting to feel like you're getting ill, you're starting to feel more fatigued, or you can't do the normal activities of daily living that you normally could do, or feverish, anything like that, and you're seeing an increase in production, that's when you should go see your healthcare provider and make sure that you're not brewing some kind of infection.
right. Okay.
Right? Yeah. And actually, Barry, your question tags into a question I'm receiving in the chat from Atish, where the question is it normal to have a lot of congestion in your chest when you wake up in the morning? Yes, Alyssa answered that. You're not deep breathing as much. You're taking nice shallow because you're relaxed. We're not doing a lot of work at night. So you may have some pooling of secretion. So When you get up in the morning, you take some nice big breaths in, you yawn, you reopen, you expand your lungs again. And so you have to clear out some of that stuff that hung out throughout the night. So that's normal. That's a normal thing that most of us do. But Atish also said they are using a CPAP machine. Could this be an issue? Well, in regards to CPAP, make sure you're cleaning it regularly. The company, whomever is supporting you, should really have gone through cleaning of that. And if you're running it without humidity, consider adding humidity in, so then you can try and loosen those secretions up from the outside in versus the inside out. I hope that answered your question, Atish. I don't see your video on, so just let me know if you have anything to add to that question. You can put it in the chat box if you'd like. Perfect, wonderful. And then one more question, Alyssa, I'm gonna let you answer this one. It came in via email just now. Can Aerobica and Air Physio be used daily to help strengthen your lungs, or are they for mucus only?
Typically, the Aerobica and the PEP devices are for the airway clearance to get the mucus out. There are other devices that can be used to strengthen the muscles around the lungs, but it's more of inspiratory. So the breathing in to strengthen those muscles. I don't believe the Aerobica or the PEP really do much for strengthening, but they really do help with clearing. I have found that with these devices, a lot of people, they get a routine. First thing in the morning, use the Aerobica, clear out your secretions, then take your inhalers, because now you've cleared out the mucus. Take your Ventolin if you use it. Now you've got a nice clean lung base for that Ventolin to really attach. And then throughout the day. So if you take your medications regular or inhalers regularly throughout the day, it's not a bad idea to do a few rounds with the Aerobica first, clear out the secretions. You just will get better medication depositing into the lungs. And it just becomes kind of a daily habit. Clearing out before bed is not a bad idea either, because then you may have a better sleep because you're clearing out as much secretions as you can before you go to sleep. And so it's less that will hopefully be there in the morning.
Perfect,
Yes,
thanks for that. Yeah, and Kathy, do you want to, oh, you're already unmuted. Go ahead and ask your question, my friend.
Okay, can you hear me?
Yes.
Okay. My issue is that I can mobilize the secretions well enough. I'm doing all of the postural drainage. I'm using the Aerobica. I'm exercising, all of that. I cannot get this gunk past my larynx. It just sits there, and I can huff and cough for 3 to 4 hours. I cannot get that crap out. Now I'm staying very hydrated. In fact, I drink so much, I spend half my life huffing and coughing and the other half on the loo. So any suggestions?
Have you been using the huff cough? That really kind of less forceful kind of cough. Yeah,
Yes.
see, yeah, usually I recommend like a combination of the two. So I even find sometimes, like for myself, if I'm sick, I will cough, huff, cough, kind of throw in a quick little huff in the cough, and can sometimes be just enough to kind of dislodge what might be stuck. So more of a and kind of fitting it in a little bit. Sometimes it really is just, yeah, figuring out how to dislodge it, because a regular cough will only clear it if it's high enough. And the trick is getting it high enough to get that cough to clear it. And the huff cough usually is enough. I know some people do sometimes use suction, but if it's too far down, you can't stick a suction down there to clear it out, right? So
I have actually tried to use suction lower down, and believe me, that's not what you want to do.
No.
Because you're gonna gag and throw up, right?
That was the worst part. I don't like doing suction on people. It looks so uncomfortable, and it makes me feel bad doing that to people, but It's necessary. but-
It might be. Now, Kathy, you're muted again, but I would recommend speaking. Do you have a physician that's looking after you or a healthcare provider?
Sorry, what was your question?
Do you have somebody that is looking after your lung health for you?
Yes, now I have bronchiectasis.
Okay, so
Mm,
and that's important to consider because each different lung condition can have different impacts on the quality of the secretions that you're creating. And sometimes different lung conditions almost create a thicker mucus. Now, this is not for everyone. This is where you speak with your healthcare provider and see if it's an option. But there are sometimes certain medications that can help break down the DNA of the mucus. Now, this is yet again, I have to say, this is not an option for everyone. This is a discussion that you should have with your doctor and say, I've tried all the physio exercises, I'm hydrating, I'm using the devices. It still feels as though I'm not clearing anything. Are there any other options for me? Because each treatment needs to be tailored to each one of your different lung conditions, right? There's no flat textbook answer that will work for everyone. So I really would go talk to your physician and say, I'm doing everything that the experts recommend. It's still not coming out. Is there anything more that you could suggest? And there might just be something that helps just that little last bit to help you get that stuff out, because that's a terrible feeling.
Yeah.
Yeah.
Right.
So I would recommend that. Yeah. Speak with them and get just try every trick in the book that might work for you. It sounds like you're already doing most of the tricks anyway. Yeah. Thank you.
Okay.
Any other questions, my friends? Maureen, do you have a question?
Okay.
There we go.
This air physio, is that? It's got a ball in here and you blow
That-
into it and the ball vibrates.
That is a device I am not familiar with.
Air physio, it's
So-
called.
Yeah, that's something I've just heard about in this presentation. So
Oh,
I
really?
can look into it. Yeah, I just didn't know. It's been a few years since I have worked with our pulmonary rehab. And when I left, this was the latest and greatest thing of all time.
Right.
So, but there's always new things that are coming out and stuff like that. So,
But it sounds like this, because when I blow into it, I can feel it in my
Vibrate
chest.
your chest.
Yeah.
I
Yeah.
just did a quick little looky-loo and it sounds like it is a PEP device. So it just looks different. Everybody
Yeah.
makes their own fancy version of it.
Right,
But it is there to help you get that goop out.
right.
Apparently I like that line, get the goop out. Also, by getting, the mucus that's in your airways go, they're like a tree that's upside down, right? So your trachea, your windpipe is the biggest and they get smaller and smaller and smaller. So a wee bit of mucus in one of those small airways can block them off, so air can't get past them. So by getting that goop out, you open up those airways again and you can expand your lungs even better. And that's kind of what that's aimed for sure. Yeah. Wonderful. Kathy works just like the aerobica. Atta girl. Great. Well then, we still have 10 minutes in the hour, but if there are no more questions, we might be able to let you go free into the sunshine, if you have sunshine.
And Lindsay, we should mention who our next guest speaker is.
Yes. So next month in August, thanks Lex, August 31st is our next webinar series. We have a physician, a respirologist that's coming to chat with us. I forget what the topic is. Alexa, do you have the exact topic name? It's okay if you don't. But
Understanding your numbers, I believe, is like
yeah,
for your breathing tests.
getting to know your baseline. So he's going to go through what your pulmonary function test means and what the numbers are. So that is August 31st, the last Wednesday of the month in August. We changed it just to accommodate his schedule. So he will be there. So yet again, if you have any questions, please put them on the Better Breathers Facebook page, email them in. And so then we can prepare him so he can just get tackled by all of your questions.
And if you have a chance, next time you're at your physician's office or something, if you don't know what your number is, so this would be your FEV1 number, that'd be something probably beneficial to have for this presentation.
Yeah. ask for your most recent report so then we can work along during the presentation.